Namaste. So today we will talk on the topic of the kneeling chair. It is good for your back or your knee, or it is not good. So what is the most right way and the authentic way of sitting? So we just prepare the model here for the kneeling chair. So how the spine of a person, how the pelvic of a person, how is the thigh bone and the shin bone of a person will be placed over it. We will see that today. So what is happening is when the person is sitting, so it is slightly inclining down, and now the knees are supported there, and now this will be the position of a person when the person is sitting on the kneeling chair. Now in this, what is happening is there is a neutral heart, there is a neutral pelvis, and now here what is happening is when you are sitting in this posture, there is a anterior pelvic tilt, so the pelvic is tilting forward, and because of that what is happening is there is a overarch in the spine comes. The overarch of the means I am saying we are having a natural curve in the spine which is concave, and because of the anterior pelvic tilt there is a aggravation is there into that curvature, and that is causing the problem of lordosis. So it can make a big changes inside your spine. So if you will see this model here, so this is our spine from the back side. So inside you will see these are the vertebrae from the back side. And you are moving the joint, so they are coming and touching and compressing with each other. Now, if you remain in the continuous state of compression like this, what is going to happen is it is causing the damage to the facet joint, and the osteoarthritis and the early aging of the spine will happen, and the person will start getting a back pain because of the posture. And now the second thing is if you are seeing the knee. So our knees are not made to carry the weight of our body on it, right? For that our feet are there, right? So what is happening is when you are sitting down like that, so there will be a pressure come to the knee patella, and which is damaging to the knee joint. Now there will be a continuous pressure will be there on the knee like that, also on the meniscus, and if you remain there for a longer time, it is actually damaging to the inner meniscus also. So what is happening is we should not sit on these kind of chairs. If you are sitting for a short time, that is fine, but if you are sitting for a long time and now all the pressure is coming there on the knees, and somehow we prepared our sitting bones for sitting after a long time, right? So there is a mechanism of the body how our body weight is supported, right? So the knee are not made to stand on it, right, or sit on it. So if somebody is doing that, so it is damaging to the kneecap and the inner tissues of the knee. And now what is more is happening is when I am sitting there, so there will be also some kind of a uncomfortableness is there into the back of my shin bone and my calf muscle. So there is a slight tension is there into that, and there is something more is happening. So I am showing you now what is actually happening in the spine when you are doing this posture and you are making the anterior pelvic tilt. So it is making excessive arc, which is called lordosis, right? So this is our lower spine. So our sacrum will be going back like this, and the spine will be bending in a concave curve, and which is causing the extreme compression into the lumbar vertebrae. And now there is some internal organs are there, like in the female reproductive system, we are having all the system into the lower cavity of the abdomen, right? In the pelvic cavity, what is happening is when you are changing the position of that, so your internal organs also change its position. Because of that, the many women are facing the problem related with the menstruation and conception. And also it is leading to some of the digestive problems as well. So what is a correct way of sitting, right? So if I'm demonstrating to you what is the correct way of sitting, like how we are supposed to sit down. So this is a flat chair, and if you are sitting down, so mostly what is happening in the offices, so they sitting like this, right? They are curving the spine and it is causing a pressure on the disc. So when we sit like this, so the early aging and the herniated disc, slip disc, it's happened in very much people, because what is happening, so there will be a continuous pressure will be remain on the lower back. So what is happening is, slowly when you are sitting straight, you don't having the strength in your back muscles, and now because of that, what is happening is your body cannot support it. So after that, you start leaning like this, and you start sitting on the back of the sitting bone and on the tailbone, which is causing a lot of complications. Now, what can be a solution for it, right? So make sure you are sitting properly on the sitting bone. Before sitting, just sit properly on the sitting bones. And now, what more you are supposed to do is, so there should be some neutral arch should be there in your spine. So it is not less or no more, so your spine should be comfortable. And there should be a good thigh support, right? So the good thigh support is very much required, right? If you don't are having thigh support, suppose you are sitting like this. Now what is happening is the pressure from your thigh bone, right, is working as a lever, and it is causing upward pressure to the lumbar spine, especially at the location of S1, L4, L5. So there will be a continuous pressure which is causing the damage to the spine. So that's why when we are buying the car also, we were talking about a good thigh support. So your knee should be open to your hip distance, the feet should be flat, right? Now that lever is gone. Because of that, the compression was happening to the lower back. And now what we are supposed to train is, we're supposed to train our core muscles, we're supposed to train our lower back muscles and the upper spine muscles, so that we can maintain a good posture in sitting. Instead of just buying like the kneeling chair, so that is not going to give you a permanent solution, but it is going to make the aggravation of some other kind of a problem. And the people who are already having the problem of lordosis, so we don't advise to use that chair, right? So always try to maintain a good pose. If you are feeling tense, right, you can move around, right, walk like after half an hour, 20 minutes, just give a nice stretch to your spine upward and give some kind of a movement into the body, so that will be perfect. Thank you for watching. Namaste.